So dear colleagues, now let's start together doing a single knot suture in a perfect way. We grab our needle at the distal part of the needle to have the best freedom of movement and the best stability. Then we go inside the tissues with our needle in a 90 degrees angle. That's very important, 90 degrees. Not like this, not like this, 90 degrees angles, 5 millimeters away from your border inside our tissues. Then the important thing is I strongly recommend to do it in a staged approach. Don't go through both sides in one movement. Go always in a staged approach to have the perfect symmetrical suture. So the first side, then on the opposite side we grab again our needle at the most distal part. Then we go again inside our other border and 5 millimeters away from our border we go out of the tissue. And now we have a more or less perfect symmetrical suture. Now how to do the knot? I recommend to do the knot like this. You have a short end of your suture and a long end. Go with your needle holder in between the short and the long end, and then go twice around your needle holder. And then you grab your short end at the most distal end and pull your needle holder inside the long end. And then you see something very fascinating. You see the perfect knot. Don't put your knot or your suture too tight because you don't want to have pressure on your soft tissues. Only the knot is tight, the suture is a little bit loose. Then you go again in between the long and the short end, this time only one time around your needle holder. You grab again your short end and now push it or pull it to the short side. And now you see beautifully how this knot closes in a perfect way. And you put your knot on one of the two sides, not above directly of your incision on the mesial or distal part. And then you have a perfect knot and a perfect suture. And we do it again. For repetition, you take your needle at the most distal part, go in between 90 degrees into your soft tissues. You go for a staged approach that you have the perfect symmetrical suture. You go outside. Don't crush your soft tissues with your tweezers. Always try to use it like this, that you don't make knots or harm to your soft tissues. And then you go out 5 millimeters away from your border in a symmetrical way. And we are going again for our knot. Again, long end, short end. You go in between the long and the short end twice around your needle holder. You take your short end and then pull it in the direction of the long end and you see a beautiful first knot. Then again in between the long and the short end, this time only one time around your needle holder, grab your short end and pull it in the direction of the short end, and now you see beautifully how this knot closes. And then you pull it on one side of your incision and you have again a beautiful knot for your suture. And now it's your turn. So dear colleagues, now we go for a modified mattress suture, a suture we often use when we have very challenging soft tissue situation. We start on one side of our incision. Always take your needle and 90 degrees when you go inside your soft tissues, 5 millimeters away from your border, and always go in a staged approach. We go outside our tissue, have a look if we are perfectly in a symmetrical way on the other side. So we go out 5 millimeters away. This looks good. And now we want to go for a mattress suture. We go back on the same side, always 90 degrees inside your soft tissues. Staged approach, that we have more precision. We leave a kind of loop here on this side because we will use this loop in a second. We go back on the other side. Always try not to harm your soft tissues with the tweezers, use it like this. And again, in the same way, we want to go for around 5 millimeters on the other side so that we are symmetrical. Now, of course, you can already close your mattress suture, but a secret is to go back before you do your knot through this loop. And with this kind of modified mattress suture, you have more stability in your mattress suture. And you see you can close beautifully such challenging wounds. Again, you go inside your short and long end of your suture. We go 1-2 times around the needle holder. Grab the most distal end of the short end, and then you see beautifully, then we pull in the direction of the long end, and you see a beautiful knot which we can close. We go again in between the long and the short end, this time only 1 time around the needle holder. We grab the most mesial part and pull it in the direction of the short end, and then we have a perfect knot which holds the pressure of your wound. And with this kind of modified mattress suture, we have a beautiful closure of challenging wounds, especially in augmentation procedures. So dear colleagues, now we do a continuous suture, and we use it especially in the edentulous jaw if we want to have a quick suturing of a defect. We first start with a kind of single interrupted technique. We go inside our tissues 5 millimeters away from the border, and always in a staged approach so that you have more precision. We go outside on the other side, symmetrical, again 5 millimeters away from your border. And now we do the knot we already showed you before. We go in between the long and the short end, twice around the needle holder, grab the most distal end of your short suture, and then pull it in the direction of the long end, and you see a beautiful knot. Then we go again inside the short and the long end, this time only 1 time around your needle holder. Grab the most distal part of your short end and then pull it in the direction of the short end. And now you see a beautiful knot. If you want to go for a continuous suture, it's now important not to do the incision of your suture. Now you continue suturing in a symmetrical way. You go inside 90 degrees angle of your needle, 5 millimeters away, on both sides of the border. And now if you put out the suture, go inside your needle and do it like this. And now you see we do a nice continuation of our suture. And now you do this kind of technique as long as your incision is. You grab the most distal part of your needle, go inside 5 millimeters away from your border on both sides, and you always have this kind of loop. Here you see this loop, and you go through this loop to have the perfect continuous suture. Now you see, and we have a perfect adaptation of our wound. And again, 5 millimeters away from the border on both sides, and we go inside the loop, coming not from this side as normal. For normal single interrupted sutures, we grab the needle inside this loop, and then we have this beautiful continued suture. And one more time, of course you can continue forever and ever. 90 degrees angle of your needle, 5 millimeters away from the border on both sides. And again, here we put the loop on top of our needle, grab the needle, and then we have this beautiful continuous suture. And now, how do you end this kind of suture? You again go inside the soft tissues, 5 millimeters away from both borders, and then you don't go through the loop, you just keep the loop like this. And now you do the suturing technique we also already showed, the knotting suture we already showed. This is now the short end, this is the long end. You go in between both of them 2 times around your needle holder, then grab the short end and pull your knot in the direction of the long end. And you see again a beautiful knot. Then again inside the long and the short end, 1 time around your needle holder, and pull the suture in the direction of the short end. And then you have a beautiful knot and a perfect adaptation of your suture. So now it's your job.